Hi, welcome, and thank you for taking the time to watch our introductory seminar on bariatric surgery. My name is Karen Hillenmeyer. I'm a physician assistant as well as the program director for the CHI St. Joseph Healthcare Center for Weight Loss Surgery. We hold the accreditation for a Center for Excellence with the American Society of Bariatric and Metabolic Surgeons. Basically what that means is that our center has met the criteria to be a safe place for you to have your surgery. We also hold distinctions with Anthem, Blue Cross Blue Shield, Aetna, Cigna, and several of the other insurance that require this as well. We have several means to support you after surgery. Our multidisciplinary team, which includes certified bariatric nurses, an exercise physiologist, a dedicated registered dietitian, amongst our other staff, are here to help support, educate you both before and after the time of surgery. In addition, we also have a Facebook page as well as an Instagram, and we encourage you to follow along on those for more information as well.
Hi, I'm Dr. Rachel Mathis. I'm a general and bariatric surgeon practicing at CHI St. Joseph East in Lexington. I grew up in North Georgia below Chattanooga, Tennessee, did my undergraduate education at Yale University, trained in medical school at the University of Georgia, and completed my residency in Northern Virginia outside Washington, D.C. I did a bariatric and advanced laparoscopic fellowship at the Leahy Clinic in Boston, where I fell in love with this area of practice. Obesity is a disease that's been growing worldwide and is actually been growing exponentially over the last few decades in the United States. In the US, more than 2/3 of Americans are overweight or obese, and there are many health problems that can stem from that. Kentucky itself ranks 8th in the country for obesity in adults. There are multiple disease states that can affect every part of your body that go hand in hand with obesity that make the treatment of obesity also affect many other areas of your life. So high blood pressure, high cholesterol, diabetes, and sleep apnea are some of the most common disease states that we see linked with obesity. And in losing weight, often through bariatric surgery, we can see significant improvements in these diseases. So what qualifies you as obese and what qualifies a patient for bariatric surgery? We look at something called the BMI, the body mass index, which is a formula that relates your weight to your height. So patients who have a BMI over 30 are considered obese. Patients that have a BMI over 40 are considered morbidly obese. Patients that have a BMI over 40 are patients that qualify for bariatric surgery without any associated medical conditions. Patients that have a BMI over 35 are patients that must have medical conditions like the ones we've discussed: high blood pressure, high cholesterol, diabetes, sleep apnea. Those patients have to have one of these conditions to qualify for bariatric surgery as well. The way that we think about weight loss is kind of a graded approach. So patients often are told by their friends, their family, their doctors, just do diet and just exercise. But we've seen that patients who only practice changes in diet and exercise can lose about 10% of their excess body weight. So the amount of weight that they weigh over the ideal weight for their height. That's not an amount that's going to get you significantly down into the area where you want to be. The next step we see is patients who do diet and exercise and some medications that can help with weight loss. And a lot of the time that can get you somewhere in the 10 to 15% range of losing excess weight. But when you actually look at bariatric surgery, it's amazing. When you combine that with diet and exercise, patients can lose 60–70% of their excess body weight, and that makes a significant difference in their health. So after bariatric surgery, it's very exciting to see how patients' medical conditions can improve or even completely resolve. We've seen almost 100% of patients' high cholesterol improve, about 95% of patients' type 2 diabetes completely go away, 90% of high blood pressure, 80–90% of your arthritis and heart disease improves as well. The benefits of surgery far, far outweigh the risks. Whenever you speak to any of our patients, the only regret that they tell us is that they haven't had this done sooner. It reduces your risk of mortality by over 50%. It reduces your risk of cancer. and it reduces the risk of heart attack, stroke, and early death. Statistics show us that women who are obese actually have 9 years less life expectancy, and men who are overweight or obese have 12 years less life expectancy than the average American.
You know, I'm 48, and I think about, every now and then I'm like, man, I wish I would have done this earlier. But if I can do it and know what's gonna happen and how I feel today, there's no way I wanna go back to that.
Hi, my name is Dr. Alberto Zorak. I'm a weight loss surgeon. I trained in general surgery at the University of Miami for 5 years before going to Atlanta, Georgia to do further training on weight loss surgery, specifically on minimally invasive techniques. Now I will talk to you about the procedures that we perform. The most common procedure across the world and in the United States is a sleeve gastrectomy. This operation consists of removing part of your stomach. That will diminish the amount of food that you can eat at one time, and also will reduce the amount of a hunger hormone, so it will decrease your appetite. So it not only restricts the amount that you can eat at one time, but also decrease your appetite. Now, the Roux-en-Y gastric bypass is an operation that not only decreases the amount of food that you can eat at one time, but also decreases the absorption of the calories that will help on losing weight. Each operation has its own indications, and we will discuss with you on a one-on-one visit which one will be better for particularly your case. At CHI St. Joseph, we are very proud of our results on these operations. And when we analyze our complications rates and compare them to the national average, we are way below the complication rate of national average on centers of excellence. So amongst the best of the best in the United States, our complications rates are in the lower end of it, which makes your operation very safe. To give you an idea of what to expect when you come to a hospital day of surgery, you will spend about an hour to 2 hours in the operating room. And once you're recovered from surgery, you will go to the hospitalization floor and spend an average of 24 hours there before being discharged. Once you get home, you will recover for a week or 10 days before reincorporating to your job. That is a very quick recovery, being able to go back to work sooner than the average before laparoscopic surgery. By performing this operation with small incisions, we're able to get you recovered fast with a lot less pain and reincorporating to your job sooner. Besides the classic operations of sleeve gastrectomy and the gastric bypass, we do offer revisional surgeries for patients that have undergone other operations and they're not satisfied. We mainly revise patients that have undergone lab bands placed in other centers that are not satisfied or are having complications, and we can remove that bands as well and convert that to other procedures. We can also revise sleeve gastrectomies that were not performed appropriately, and to revise those or convert them to a gastric bypass.
The surgery was actually pretty easy. I mean, went in, I spent the night, I had the bypass surgery. And I stayed overnight, but was released the next day. Pain was minimum, and I have really had zero complications since I've had this.
Well, you've learned quite a bit about the two operative procedures that we do. We're going to switch gears a little bit and talk about the dietary approach. The diet is very important. Changing your lifestyle is what is going to make or not your weight loss surgery to be successful. Our dietitian will meet with you before the surgery as well as after. Actually, from the very first appointment that you have in our clinic, you'll be meeting one-on-one with her. She'll talk with you and give you a pre-operative plan so that you can start making these changes. You'll also be meeting with our exercise physiologist. Irregardless of some of the limitations that you may have, be it back pain, knee pain, whatever, she'll be able to work with you to increase your mobility. This is going to be important. As you lose weight rapidly, we want most of that weight to come off as fat mass and preserve your lean muscle mass. We'll have other educational programs that you'll attend before the time of the surgery as well. One of those is our bariatric boot camp. That's a class that's scheduled just prior to your surgery, where our nurses will go over the preparation for the hospital, the details about what happens in the hospital, as well as what you're going to need to do to take care of yourself for the first week or so at home. We feel that it's very important that you feel comfortable about what you need to be doing. My goal for our staff is that every time you come into the clinic, we'll give you in both written format as well as to verbally explain to you what you need to be doing between that appointment and the next time you come back, whether that appointment is in a month or 3 months or maybe even a year down the road. Oftentimes I'm asked, how many appointments will this require? When you're coming in for workup for weight loss surgery, we try to schedule many things to be done at one time. So you may be here for quite a few hours, but we're going to do several things at one time. You'll be having clinic visits with both the practitioners, the dietitian, the exercise physiologist, as well as getting your labs and perhaps all of your testing done on one day. In terms of follow-ups after surgery, we also try to incorporate several things at one time. Typically, we'll see you back 2 weeks after surgery, then at your 1-month appointment, at 3 months, at 6 months, and then annually. We'll also try to tie those appointments in so you'll be seeing the dietitian and exercise physiologist with those visits as well. At the Center for Weight Loss Surgery, we offer a variety of support group meetings. Our monthly support group meetings will have a variety of topics. Sometimes our topics will be dietary in nature, sometimes they'll be exercise, and sometimes we'll have a guest speaker, perhaps a psychologist, to come in and talk about some of the psychological changes that go along with extreme weight loss. It's very important that you stay involved and that you stay connected with the program, and support group meetings are only one of the means that you can do that. To make it easier for you, we also have our Facebook page as well as our Instagram page. Those are just additional ways that you can stay connected daily and see something important coming along your news feed to remind you of the importance of the lifestyle changes and the commitment that you've made. In order to have the best outcomes from weight loss surgery, patients must have realistic expectations. One of the things that's most important to us is to make sure that you understand about the changes that are going to be made. We're even going to give you a little test. You'll fill in a true-false test to let us know if we've done our job to communicate to you the things that we feel are important for you to know to be the most successful with your journey. There are several things also that are important. One of the things is that patients must be committed to be nicotine-free for a minimum of 90 days prior to surgery. Patients often ask me, why is that? The answer is actually threefold. 1, we're trying to improve your overall health. 2, as the body gets bigger, some organs get bigger, but the lungs don't. Actually, as the tummy gets bigger and pushes up on the diaphragm, it makes it even harder for the lungs to work properly. When we have a patient lying flat on the operating room table, that increased pressure inside the lungs makes it a little harder to ventilate. And that's why you often hear about patients that are overweight having more pulmonary complications after surgery, irregardless of the type of surgery. The third reason is that nicotine is a vasoconstrictor. What that means is that nicotine makes those little small blood vessels even smaller. Where we're cutting across the stomach or the small bowel, blood supply is very important for healing. We want to see that we have good perfusion or good blood supply to these areas. If the nicotine has constricted those areas of blood supply to the tissue, we can sometimes have difficulty with tissue healing. This can even worsen to the point of sometimes having tissue breakdown or ulceration, which is something that we don't want you to have to deal with. So those are the reasons that giving up nicotine prior to surgery, as well as a very strong commitment to be nicotine-free lifelong, is imperative for your overall success. Many times ladies ask us, is it safe to become pregnant, to have a baby after having weight loss surgery? Actually, if you look at the OB literature, it's very supportive of having extreme weight loss for those mommies that are extremely overweight prior to the commitment of pregnancy and carrying and having a healthy delivery. Oftentimes, many patients are referred to us by their obstetricians for this purpose. We do ask that you wait for about a year after your weight loss surgery. The reason for this is it just doesn't make sense to be trying to grow a happy, healthy baby during the very rapid weight loss that mommy is going to go through during the first year of surgery. So if you've made it this far through our video, you may be wondering, what's next? What are my next steps if I want to join the program and start the process to consider having weight loss surgery? First of all, we'll need the front and back side of your insurance card. We'll contact your insurance company to make sure that you have benefits for weight loss surgery. We hate to get into the insurance part, but even more so, we hate for a patient to make unnecessary trips or have a lot of testing done and then find out that they have out-of-pocket expenses that they didn't anticipate. That's certainly not fun. We'll also provide a link for you to go into our software system. You can upload all of your data into that system. Once you have answered those questions and uploaded things to us, that information comes directly to our insurance coordinator. At that point, once she has verified your insurance benefits, she'll contact you for your first appointment. That first appointment can either be done in our clinic or online via telemedicine. Once we've arranged that, during that appointment, we're going to be going through your specific history, your medical history, your surgical history, the medications you're on, and some of your dietary preferences. One of the things that makes our program most successful, I think, is that we really target your treatment plan to your individual needs. There's not a one-size-fits-all. There's not one operative procedure or one treatment plan that's best for every patient. So we really dig into those areas to find out what we feel is going to work best for you. All of our patients will take a psychological exam prior to the time of surgery. We want to make sure if there are any underlying mental health conditions that those have been addressed and we've made the appropriate recommendations surgically to not upset any mental health conditions. We also want to make sure that you have the understanding and that you have the motivation to make the behavioral changes that you're going to need to make this most successful for you. We'll also do your testing that day. You'll have laboratory studies done. We're going to look at a battery of things that most surgeons need prior to surgery. We'll be looking at things like serum electrolytes, liver function, kidney function, thyroid function, blood cell count, hemoglobin A1C, which you diabetics know means whether or not you're diabetic and how well that blood sugar is controlled. We'll also be doing a study called an esophagogastroduodenoscopy. Wow, big word. Basically, that means the scope test. Anesthesia will be at your bedside. They're going to give you some medication to put you to sleep for about 10 minutes. During that time, we'll gently put a small scope, flexible scope, down into the esophagus and stomach and look around. People ask me all the time, why are you doing that? Well, the reason is we want to make sure that you have a happy, healthy stomach before the time of surgery. We find a lot of surprises. We want to make sure that you don't have irritation or gastritis in the stomach, that you don't have any polyps, any tumors, anything that might need to be treated or need to be addressed before the time of the surgery. We're also going to do some little biopsies for a bacteria called H. pylori. H. pylori is a sneaky little bacteria. Many of you may be shaking your heads right now because you've heard of it and may have already been treated for it in the past. We see a very high prevalence of H. pylori in our patient population. The problem with H. pylori is it doesn't cause a lot of symptoms, maybe a little food intolerances or maybe a little upset stomach now and then, but if left untreated for a long period of time, is associated with development of other problems, such as ulcers or even more serious conditions in the stomach. So if this is positive, we'll treat you for a couple of weeks and then it's safe to proceed with your procedure. One thing that's always difficult for us to talk about is insurance. The reason is there's so many different insurance companies, and even in one insurance company, there can be so many different policies. It's very important that we contact your individual policy, your insurance company, and find out what your particular benefits are. We'll go over these with you and we'll try to find out to the best of our ability any out-of-pocket expenses that you may have and let you know about these prior to the time of the operative procedure. Some patients will have what we call an exclusion policy. What is an exclusion policy, you may ask? An exclusion policy basically means no matter what your weight is or what physicians have recommended that you have weight loss surgery, it's just not part of your policy. If that's the case, we do have a discounted self-pay program. If you fall into this group of patients, please let us know. We've tried to make this as affordable as absolutely possible for our patients. So we have a bundled rate which includes the hospital, the anesthesiologist, and the surgeon. If you have any questions about that, please don't hesitate to contact our office and let us know. We also have a $350 program fee. This is an out-of-pocket fee that is not covered by your insurance company. What this covers is all the education, all the support that's given to you by our staff. written materials, meetings, support groups, ongoing. To try to make that pill a little easier to swallow, we break that $350 fee into two components. The first half you'll pay at the very first visit when you come in for your consultation. And the second one is not due until the time your surgery's scheduled and you come in to meet your surgeon. That second half of the fee is good for your lifelong education, and there'll be no additional out-of-pocket program fees after this. I've been asked if it's possible to use an HSA card to cover this program fee, and absolutely it is. If you have questions about that, again, please don't hesitate to contact our staff. In order to have the best outcome from your weight loss surgery, you'll need to have realistic expectations. What that'll take is hard work, compliance with our program guidelines, and a commitment to lifelong changes. Thank you for taking the time to watch our video today on weight loss surgery. We hope that we've been able to answer some of the questions that you may have about bariatric surgery. If you have any others, please don't hesitate to contact our staff. Thank you.